Hello team members, providers, volunteers, and affiliates. I'm Sandy Leek, the Chief Nursing Officer. Today you're going to hear from me, Dr. Gray, Dr. Shamia, and Mr. Landsman, and we're here to assure you that we see you. We see the challenges you're being faced with every day while entering year 3 of this pandemic, and we continue to actively work day after day and week after week to implement new strategies to support you. Many of these strategies have been based on your feedback and your suggestions, and you have our commitment to continue them. As of today, we are on pace to surpass our highest number of hospitalized patients with COVID-19, and staff absences due to illness have reached an all-time high. We know that you are tired. We know that you're feeling the weight of these challenges, and we thank you for all you're doing for our patients, for our community, and especially for each other during this time. We will continue to navigate this together, and we will get through this by working together.
There is some good news on the horizon. We hope that we are about a week away from the Omicron peak. Many of our current staffing challenges are due to staff illness from COVID-19, and hopefully this should start to improve rapidly. As COVID inpatient census drops and staff absence decreases, our capacity challenges will improve. Right now, the medical center and ED are what's known as critical status. This generally means that ambulance traffic would preferentially stop at other hospitals. However, because almost every local hospital is at the same status, the end effect is minimal. Therefore, on a daily basis, we have a very significant number of patients in our emergency department waiting for a bed upstairs. We are doing several things to try to improve the overall situation. We have a daily clinical huddle to help problem solve around patient flow to ensure that patients most in need are bedded as quickly as possible. We are encouraging early discharges and encouraging use of our discharge lounge to try to open beds as early as possible. The surgery schedule had already been modified so that most of the cases on the schedule are clinically time sensitive, and we are trying to absolutely minimize non-time sensitive cases that need a bed. We know that staff have been moved around to cover staffing needs, and many have done extra. We want to extend a big thank you to everyone who's done this.
I want to say thank you to our frontline clinical caregivers. We see you covering in crisis areas, working extra shifts, and offering support to team members beside you. We value you. Other hospitals across the country, and especially those in Tennessee, are experiencing similar stresses. Unlike previous surges, outside resources like the National Guard are not currently available, as Tennessee has not declared a state of emergency. We continue to work tirelessly to streamline your workflow while still being able to offer safe patient care and meet regulatory requirements. We appreciate the work everyone is doing to expedite discharges and work with our community care network to create capacity for the large volume of patients seeking the compassionate care we provide. We continue to be open to your ideas and feedback, and beginning next week, you will see organizational leaders rounding in your areas more frequently. Again, we thank you for all that you do.
So now that you've heard from Dr. Leek, Dr. Shamia, and Dr. Gray, it's pretty obvious that this pandemic is still with us. We're entering into the 3rd year of having to deal with a global pandemic and the impact that it has had on all of us, including our community and our patients. You all have been absolutely incredible in your dedication, your compassion, and your commitment to serving, to sticking with us through this pandemic. Every one of you is critically important to our ability to care for our community and specifically to our patients. I want to thank you for all you do. You're doing incredible work, and I know many of you go home at night and feel like you could have done more, and I want you to know you couldn't have. This is not a situation that you created. It's not a situation you can control, but what you've done to help us get through this will be forever appreciated, and we are incredibly grateful of you and your effort. Give yourself a little grace in this period of time. Hang in there with us. If you have any ideas of things we might be able to do to help, particularly with the staffing, please let us know. And we'll get through this, and hopefully we'll get back to some semblance of normal very soon. Thank you all for what you do. We really appreciate you.